And your role basically is to coax the brain, absolutely convince it that you got to get sexual function back, and urinary function as well. So these are all things that I think work together.
This podcast deals with prostate cancer, surgery, medication, and other medical topics. The host is a prostate cancer survivor who is recounting his experience with treatment. He is not a medical professional, and you should not use his commentary as medical advice. Please always consult a medical professional when learning about and understanding prostate cancer or any other disease.
Well, a big welcome to Mark's Prostate Cancer Experience. This is the one place where hopefully you get all answers to do with prostate cancer, recurrence, sexual function, et cetera, et cetera, et cetera. Well, my name is Mark, and I want to welcome you. It's been quite a few months since I've done any kind of a podcast or YouTube video, and the main reason being is that life has been quite amazing at the point that I'm at right now with prostate cancer and recovery, et cetera, and I'll talk about that in just a moment. But for those of you that are new to this channel, I had prostate cancer in November of 2015. I had a prostatectomy. My prostate was removed. Roughly 8 years later, my PSA started to rise. It got to a point where we decided at point 4, we were going to do radiation, which we did this summer. And that was in July. And now it is just the middle of December 2024. And I'm really happy to report that the cancer seems to, at least for now, be gone for good. So my PSA is undetectable. And I did some episodes this summer when I had the radiation for recurrence and detailed all of that. And I'll talk about that in just a minute because there's a lot of important information that I learned about radiation and especially for recurrence and the side effects and things to anticipate. But mostly, I just wanted to tell all of you that are watching or listening on my podcast, there's a lot of information that you can pick up online. And the problem with the internet is there's just so much information. A lot of times you're going to read about or read articles that are not so positive. You tend to hear about the bad stuff before the good stuff, but there are so many surgeries and radiation procedures and other procedures done every year that it's a very survivable cancer. And if you're newly diagnosed with prostate cancer, and particularly if you're low to medium grade, this is something that is not going to kill you. You're going to live through it as long as you seek treatment and consult with the appropriate professionals. And so it's really something that just has to be dealt with. But I did want to jump into my own process just a little bit because I'm going to talk a little bit in this video about sexual activity, sexual function and dysfunction, and some of the related side effects. But since I haven't done a podcast or video since my radiation this summer, I wanted to at least share some of my post-radiation experiences with you. So I've done a lot of videos, and some of you have watched my whole series, which go way back, almost 10 years, if you can believe it. I'm a little bit grayer now, but certainly a lot smarter. And so, when I had the first diagnosis, and in 2015, the treatments were pretty straightforward. There's more options now, and there's more knowledge that we have now. And with AI and computers and robotics, there's a lot of things that have sort of come to play. But the removal of your prostatectomy is still kind of the gold standard, although imaging and, I believe within 5 years, anybody diagnosed with early prostate cancer will be able to survive it without surgery. I truly believe that. And I think AI is going to have a lot to do with that. But, when you are diagnosed, you have to make some decisions. Do you get radiation? Do you have it removed? Do you do spot therapy, seeds, cyberknife, all these different things that are there? And those are very important decisions to have with your provider. My feeling on prostate cancer treatment has always been, and still remains to this day, even with the advances that we have, that once you're diagnosed, if it's low grade or medium grade, you just remove your prostate and you kind of deal with the consequences. Although sometimes they're not as pretty as we would like to see. But so in my case, when I had my prostate removed, there was a positive margin, and a positive margin is when the surgeon removes the prostate and some of the tissue, where they remove the prostate, it's attached to the body. There's some prostate tissue left over, and it, in my case, had, I guess, what you call the seeds, the microscopic seeds of the prostate cancer. So most of it was removed with the prostate, but there was a little bit left behind. And so a positive margin is when the prostate, the area, the part of the body it was touching when it was removed, has left behind some tissue. It doesn't always happen, but in my case, we believe it did. And the funny thing is, even to this day in 2024, they can never accurately detect prostate cancer in the body without a biopsy. The only way they can absolutely determine it's prostate cancer is to do a chemical analysis, and so they can't do it with imaging. I do believe, like I said, within a few years, the computers and AI will enable the doctors to scan the body and really find where the prostate cancer is. The problem is some prostate cancer is microscopic in nature. So some of it you'll see, but some of it you won't see. So if you spot treat prostate cancer, it's kind of a whack-a-mole approach, which maybe is suitable for gentlemen who are a little bit older, who have a, not that they have a shorter lifespan, but they're not decades and decades for it to evolve, because prostate cancer can be very slow moving. But anyway, so I had a recurrence. Very slowly it started to move up, but it hit 0.2. And, when your PSA hits 0.2, that's usually kind of a warning sign that maybe there's been a biochemical recurrence, which means some prostate cancer has come back. I waited until 0.4, but the movement from 0.1 to 0.2 to 0.4 was a year or so. So it was very slow moving, but I made the option to eradicate it for once and for all with radiation this summer. And like I said, I documented some of that. So the radiation procedure itself, which was, I had 39 sessions of proton radiation. It really is benign. It's not like you feel anything. There are some side effects. Sometimes there's irritation with the stomach or the bowel, but it's really nothing that you can't live with, or live without, I should say. It's perfectly okay. The problem is that when they're radiating, they're not just radiating the prostate bed. Some of your bladder, some of your stomach, some of your rectal area is also getting radiation. So those areas can get irritated. And one thing that I found is, even though there was not a lot of discomfort, for about a month or two after the radiation, I noticed that my bowel movements, they were very, very different. So it wasn't constipation, but it just felt that there was a constriction there. And I believe what that came from was the area that gets irradiated. I guess it gets inflamed and it stays a while, but there's, after radiation, there's potential for fibrosis, which is sort of, hardening of the tissue. There's different things that can happen. So it's different for everybody. But thankfully, that didn't last for too long. And now in December, once again, my radiation was the month of July in Knoxville, Tennessee. And so, I'm kind of back to my old self now, and I feel fine. Everything's working fine. Life is good. Business is good. There's a lot of happiness. There's love in my family. I love someone, that someone loves me. It's just it's a great place to be. It also enables me to try to spend and dedicate as much of my extra time as possible to helping others who might have questions. And it's amazing to me when I read some of the comments in my Facebook group, or I get a lot of texts and I get a lot of comments in YouTube. I try to answer as many as possible, but sometimes it's a little difficult. But I read every comment that's posted. It's amazing to me how a lot of people are still not informed properly of how to prepare yourself for treatment, and when to seek treatment and when it makes sense. And to really understand that if you are diagnosed with prostate cancer and you do nothing about it, it can be a brutal, brutal killer, but it takes a while. And the way that it's brutal is that once prostate cancer decides to evolve to a point where it escapes the prostate, it almost always heads right for the bones. And then it's a horrific, horrific bout with bone cancer and other metastases. So it gets very, very ugly and very horrible. And if any of you know anyone that's died from prostate cancer, and once again, it's not the prostate cancer that kills you, it's the metastasis into bones and other tissue. So, but it's horrific, and we've lost a lot of people that way. So, one of my missions, as best I can, is to be out there in the public eye here on YouTube and in my podcast, cheery, smiling, happy, having gone through the whole process, not just the prostatectomy, the removal of the prostate, but the radiation as well. So I kind of had a double whammy. There are some of you who might opt to do radiation before surgery or instead of surgery, and that certainly is an option. The technology has certainly evolved. The problem is that with prostate cancer, recurrence is possible. I think, don't quote me on this, I think 30% of the time when you have a first round of treatment with prostate cancer, it comes back. So in my case, if you had surgery and it comes back and you catch it early enough, usually radiation therapy will resolve it for good. That's it. If you have radiation first and then the cancer comes back, it's very difficult to do surgery after the fact. So normally the way that they treat it is with ADTs and these hormones that deplete your body of testosterone, which is by the way, when you do radiation, you're on hormone therapy for 3, 4, 5, 6 months. It's livable, but it changes your life quite a bit in a noticeable way. So hopefully you guys all have great advice. But, my 10th year anniversary will be November 2025. And I've spoken to enough men who have had complications from surgery. It's unusual that you have complications from radiation. There's a multitude of other treatments now where they spot treat the cancer. But I think surgery is the one that is most prevalent. And the side effects that people worry about most, which are the most common, are incontinence and sexual dysfunction. And so where this comes from is when your prostate is removed, there are nerve bundles that surround the prostate. And there's also your pelvic floor muscles or your sphincter, which is used for urine control, is part of the whole mechanism that enables you to urinate and hold urine. And the nerve fibers in conjunction with the prostate are responsible for erectile function. So when a surgeon gets in there and starts plucking out the prostate, sometimes there's some damage done. And there's no one piece of advice I can give you on how to avoid complications other than to pick a surgeon who is very well experienced. And to me, an experienced surgeon is someone who's done more than 2,000 robotic surgeries for prostate cancer, where they are the surgeon there the whole time. They're not handing off to someone else. They're there from the beginning through the end. It's also helpful if your surgeon does these on a regular basis. So I would always ask a surgeon, does he or she, usually it's a he, but it can be a she as well, how many times a week do they do prostatectomies? You want it to be a couple days a week, 3 to 5 to 6 to 8 surgeries a week. If this surgeon is doing thousands of surgeries and they do multiple surgeries a week, they really are in the game, and they tend to do a good job, at least from what I can tell. My surgery was done by Dr. David Samadi in New York City, and I think a lot of you know that. He's one of many across the country and across the world who do an excellent job. So wherever you're located, try to find someone that does robotic surgery for prostate cancer several times a week with more than 2,000 under their belt. And there's a really good chance that that surgeon will know what they're doing. So, but how do you prepare your body for surgery? Well, you're going to have some Kegel exercises that people will tell you about. Pay attention. You must do Kegel exercises. That is not an option. And you do them every day, all the time, starting at about 30 days before surgery. And what that's going to do is that's going to ensure that your sphincter and your pelvic floor muscles are very strong. So once the prostate is removed, you'll have very strong urine control. But sexual function, that's the big one. And I get a lot of comments and emails and texts from people who are having sexual dysfunction problems. This is a tricky one because it's the talent of the surgeon mostly, but sometimes it's your body as well. But if indeed you're going to have surgery, have the discussion with your surgeon about their technique for removing the prostate, because you're going to hear the term nerve sparing techniques an awful lot. And, but sometimes it's just something that is said and not something that's done. So what you want to try to do is understand from your surgeon what their technique is to spare your nerves as much as possible. Sometimes when you're having surgery, the surgeon will start taking away some of the surrounding tissue. Sometimes they have to cut the nerves. It's not always an option. It all really depends how your body is and how advanced the cancer is. When the surgeon is in there with the Da Vinci robot, they have a visual representation. They're actually in there. It's an amazing technology. They're in there with close-up cameras, and they're in 3D. So it's like they're really there with the prostate. They can sometimes eyeball things that are areas of concern. So sometimes lymph nodes get removed, but the vast majority of people that I speak to, if they're healthy and they have a good surgeon, they get some kind of erectile function back. And part of the recovery of that, I believe, now this is my non-scientific approach, but I do believe that once you've had the surgery and once your brain has, when you have surgery, your body goes into shock, your brain disconnects itself from your pelvic area with respect to sexual function. So when you have that surgery, your brain says, I guess the erectile function is gone, so you have to help it reconnect. And the way you help it reconnect is by coaxing it. And I've done a couple different videos on this, but once your catheter is removed and about a month has gone by after surgery, you want to try to stimulate yourself manually to really encourage the brain to kind of reconnect itself. And for me, it worked very well. And there were some techniques with Viagra to kind of encourage things to move along. But maybe I was lucky. I had full erectile function back at 3 months, roughly. That's not always the case for everybody. But I do believe, to a certain extent, I willed my way into recovery. So from the get-go, from my very, very first video in New York City at that hotel, and you can see that on YouTube, I'm sitting there saying, I'm going to beat this. I'm very positive about this. I got to get rid of this cancer, get that prostate the heck out of here. And then when the surgery was done, I've got to get my continence and I've got to get my erectile function going. So what can I do? What can I do? The continence was not an issue for me. I had full control almost right away. When I say full control, I could start and stop urine flow. Your muscles will continue to evolve. It probably took me about a year before I really felt that I never had, you have the occasional accident. But after a year, I really felt I had complete control. One thing that happens during sexual activity is when you have your prostate and you're going to have an orgasm, your prostate actually turns off the valve for urine. So if you ever noticed, if you're ejaculating, it's impossible for you to pee. It's just not possible because the prostate prevents that from happening. Well, when the prostate is gone, that control isn't there. So what you might find is during ejaculation, it is a dry ejaculation. There's no more ejaculate that comes out because it's been snipped away. But sometimes urine will come out, which is kind of shocking, and it's a little embarrassing at times. But there are ways around that in the early days. If you lie on your back, it tends to kind of help. But after about a year or so, there's no more leakage during sex. Everything is fine. It just seems to kind of repair itself. But you have to be very patient, and you have to kind of let the body do its job. But you have a role in that recovery, and your role basically is to coax the brain, absolutely convinced that you got to get sexual function back, and urinary function as well. So these are all things that I think work together. I'm not giving you a scientific approach to any of this, but it's just something that worked for me. And I just found that I could will my way into doing it. So, maybe I'm a lucky case, but as long as you have that hope, then the possibility is there. So life goes on, and I'm trying to keep an eye on evolving technologies for the treatment of prostate cancer. And I'm going to try to in 2025, and I was supposed to do this year and I didn't, but I'm going to try to start getting some guest speakers on some of my podcasts to really talk about what's happening in prostate cancer treatment and recovery and recurrence. Recurrence is something that we're always keeping our eye on. So kind of keep an eye out for that. And if there ever is a topic that you really want to get more information on and you think having a video or a podcast about it would help others, drop me a note, let me know, and I'm open to all ideas. It's funny because I'm at the point now where, if there's another recurrence for me, you never know. I'm just putting that off. I'm putting that on my mind, but anything's possible. But where my mind is at right now is that I've gone through the surgery and the radiation, and sometimes it's like, what else is there to talk about, right? So, what there is to talk about are our collective experiences. And so not just my experiences, but the experience that each of you have had. Some of you who watch this or listen to this are wives or partners of men going through prostate cancer. So I always appreciate those questions. Sometimes people who are diagnosed don't know where to look for answers or are embarrassed by it or shy. And I'm not. I will speak about anything. I'll talk about erectile function, ejaculation. It doesn't matter. These are all things that kind of bond us together at this point. So for now, I just want to wish everybody the happiest of holidays and keep questions coming. I will always do my part to answer as best I can. And in the meantime, I'm just wishing the best for all of you and keep looking for more episodes in the new year.